Yes, I hope all of you can hear me. Yeah, I hope all of you can hear me. Yes, without any delay, we shall start the class. This is the second case series of Ayurveda successful treatment. Here, we are going to share, I'm going to share my experience on how I treated Jwara. Okay, it is not the one where I'm dictating you or teaching you how Vata is involved in the Jwara, what are the Vata Lakshanas, and how do you treat such case. It's not like that. Very directly, a patient came to us, and how I diagnosed a case and how I treated with Shaman Aushadis. Here, I have not given any type of Panchakarma treatment to patients. Just the Shaman Aushadis, using the Shaman Aushadis, how we are treating the patient. That thing we are going to discuss. Okay? Yeah, I'm Dr. Roja Eddy, completed BMS MD in Ayurveda, consultant position in Ayur Central BTM layout, Bangalore. We shall discuss the class now. Yeah. The first case is one. A girl child of 6 years came with complaints of fever and of along with rhinitis, slight cough from past 2 days. Okay. See, you are sitting in a clinic. You remember that. You just imagine that you are sitting in a clinic. A girl, child of 6 years, she came with her mother. Her mother is telling history that she has on and off fever, rhinitis, and slight cough from past 2 days. Then, what do you advise to a patient? How do you treat a patient? So you check all the vitals, pulse rate you need to check, BP you need to check if you can. So, but BP has to be checked in case of fever. But it is from past 2 days, it is okay. If any patient has fever from past 3 days or more than 3 days, you need to check BP and pulse rate very carefully. Why? Because I'll tell you. See, patients of fever, they will get dehydrated, worsen day by day. This dehydration, it worsen day by day, for which many systemic functions will for which many systemic functions will alter. So, if patient has pulse rate of more than 80 and the BP is more less than 90 by 60 like this, so patient is in dehydration. He is in hypovolemic shock. It is an emergency condition. So, what you have to treat is you have to rehydrate a patient. You have to give some antibiotics and you have to rehydrate a patient. So, that is the significance of vitals. We need to check vitals in case of fever. Okay, and weight is 17 kg and not dehydrated. So patient is not dehydrated so that I can treat in Ayurveda. Even the patient is dehydrated, you can treat in Ayurveda. The main line of treatment is you have to rehydrate patient by giving some of the fluids which are with electrolytes, sodium, potassium, and chloride. All electrolytes should be there along with a little quantity of sugar content. So you have to rehydrate a patient. So suddenly you can't give 1 liter of water to a patient, right? You drink, and this she's a baby of six, a girl child of 6 years. So that child, she doesn't have very big stomach like us, and she can't drink that much. So you can give baby every half an hour 200 to 300 ml of liquid like that. Like that, you have to rehydrate a patient. Gradually, we need to rehydrate. It is not that 1 liter, 2 liter given very suddenly, so body has picked up suddenly. Our body also needs some time to come back to our homeostasis. Next thing is which type of fever it is. See, patient has fever on and off, rhinitis and slight cough. But just by knowing the symptoms, we can tell that patient has fever on and off. If the patient has on and off fever, then it is of Vataja. Okay. If it is of continuous fever, then it is of Pittaja. If the patient has fever, sometimes it is more, sometimes it is less. Otherwise, sometimes patient has mild fever like symptoms. Body is almost mild fever, but patient has drowsiness and Guru Gatrata, all these symptoms are there. In such conditions, it is kaphaja. So now on and off, if patient has fever, that is a symptom of Vataja Jwara. Rhinitis and slight cough is there. Just by hearing the symptoms of a patient, so it is Vata Kaphaja, we can tell. And how to treat such type of patients and what Pathya shall I suggest? These three are very, very essential. Right. See, any fever patient comes, Pathya is very, very important. But why? Because it here is the Agni which is hampered. Due to this hampered Agni, Srotras get obstructed for which patient has fever. Right. So how I treated such patient? Let's go to the next slide. So it is Vata Kafaja. Uh, in Vata Kafaja, Tribhuvana Kirti Rasa is given. She is a child of 6 years and her weight is 17 kg. Any pediatric patients comes, you need to check the weight. This is must and should. According to the weight of the patient, it has got the most significance in modern science, but we need to check the weight. Then only we will get to know about the healthy status of pediatric patients. Right? So, Tribhukayana Kirti Rasa is one of the Rasa Aushadhis which is particularly given to Vata Kafaja Jwara. It is not Vata Pittaja or Pitta Kafaja Jwara. It is particularly for Vata Kafaja Jwara, which is mentioned in classics. Okay. Then Amrita Arishta, 5 ml. See, the dosage of Amrita Arishta in adults is 10 to 15 ml, or you may go up to 20 ml. Okay, 10 to 20 ml according to the Bala and Agni of a patient. But she is a pediatric patient, so I have given 5 ml TID with 5 ml of water. It has to be diluted with 5 ml of water. I hope all of you know how to advise Arishtas. Arishtas are not given as it is. It has to be diluted with water, then only it has to be given to patient. Okay. Then afluocil is one of the patented medicine which is given to a patient because patient suddenly have a fever which is of Vata Kaphaja due to the symptoms. Why? Because it may be infectious or it may be viral fever. That's why afluocil is one of the patented medications which I suggested. That is from Hamil Pharmaceuticals Company. Then, what diet did I suggest is Mudga Yosha. See, Mudga Yosha along with rice. Why Mudga Yosha? I will tell you after that while discussing the diet which is prescribed for Jwara. But here in Vata Kafaja, I suggested Mudga Yosha. And along with that, she has rhinitis along with the slight cough, so steam inhalation is given. Any patients comes with either sinusitis, running nose, blockage of nose, or heaviness of the body, the best treatment than any medications which works is steam inhalation. Patient has to take hot water steam. Along with that, for this hot water steam inhalation, many medicines will come. Pranadhara is one which comes from Maharshi Amrit. And if you are all students who have joined, you better should have one notebook so you can note the things whatever I will mention. Why? Because these are all very unfamiliar to all of you because you have not started to practice. If you have started to practice, so the all company drugs they will be in your mouth. Here, Pranadhara is one of the liquid. This is a nasal liquid from Maharshi Maharshi Ayurveda company. So put 2 drops into the hot water where steam was coming, and patient has to take the steam inhalation. Duration of treatment is 5 days. Okay. So this is how I treated a child of 6 years who were suffering from fever. Okay. It is just the simple fever, even seasonally also it may come or anything. Just by some shaman aushadis, patients got treated. So after 5 days of the treatment, in between the treatment, on third day, her mother called me and she was asking me that now my child has developed. Now my child has developed earache. Why? Then she had running nose and she had a slight cough. All are very ear, nose, and throat. They are interconnected. We are know all of us. They spread very often. So for that, I told her to take just Sharatela, instead 2 drops of Sharatela into each ears. Okay, then she took that Ksharathaila on third, fourth, and fifth day. Her earache was reduced within 12 hours of administering medications. This is how I treated this case. The next case is case 2. A male patient of 35 years came with complaints of fever for past 2 days associated with body ache, generalized weakness. See, male patient came to you, you are sitting in a clinic, he is of 35 years, he was complaining of continuous fever for past 2 days and it was associated with body ache, generalized weakness. And he doesn't have any comorbidity. See, once patient came to your clinic, you need to check for any no very familiar comorbidities like hypertension, diabetes, or any bronchial asthma, any allergy condition. These 4 things you need to ask. Nowadays, many female patients are suffering from hypothyroidism, most common cases. That too, also we need to note. Any female patient comes, there also you need to ask for menstrual history, though they come with a history of fever. That is must and should. Then here it is a male patient, 35 years, of course, after 35 years, nowadays, even from the age of 25 years, also patient has many comorbidities. So he's of 35 years, we asked for any comorbidities. Does he have any allergic condition? So nothing he had, and his weight is 82. His vitals were stable, BP, everything, pulse rate, everything was stable. He is not dehydrated. So from past 2 days, actually many patients don't get dehydrated. Only after 3 days, most of the patients get dehydrated. And here what treatment I gave is Amritarishta 10 ml, which is given TID after food, which is diluted with 10 ml of water. And here, Mrutyunjay Rasa I advise because patient has continuous fever. We need some strong medications to work on that, right? So Mrutyunjay Rasa is given after food and Arogyavardhini Vati was given morning and night after food. Then hydrate. We told patient to drink enough quantity of water. This is must and should advise. And which type of fever is it is? It is a continuous fever, of course, Pittaja, associated with body ache, generalized weakness, Vata Pittaja as well. So Amrita Rishta is given, Mrutyunjaya Rasa, and Arogya Vardhini Vata is given. So in such type of case, when patient has continuous fever, if it is not decreasing, and once you measure with temperature, if it is more than 102, 103, we need to give some rasaushadis. So I have not advised any rasaushadi which are of very costly like Jayamangala ras. You might have heard this one, or you might not have heard. Jayamangala Rasa is a wonderful medication. The cost of just 10 tablets from Doodh Publisher Company, it may be more than 2000 or 2000, but it works wonders. It which suddenly decreases this temperature. If the patient is, yeah, any fever patient comes, he is not ready to spend 2000 rupees on just 10 medications because for Dolo, how much it will be? For 20 rupees, you make it 10 tablets. Of course, it will also decrease the temperature within 2 to 3 hours, right? Then why he need to spend more money on that? This is the problem we may face when we practice. But instead of that, I gave Mrutyunjay Rasa, Arogyavardhini Vati, hydration, and Amrita Rishta. So patient fever has reduced. You may ask me a question, Miss Ma'am, how do you came to know that patient was not having fever after 3 days or 5 days? Because these are the patients who are coming to me for follow-up. See, in Ayurveda, what happens is if we treat one patient, if they get cured of their disease, they will take one more patient to us, of their family members. They may take one more patient to us and one more friend of them to us. This is a speciality of Ayurveda practice. Many times when we started to practice, it is the mother, father, daughter, and grandsons. All 4 members are my patients in my clinic from past 6 months. I started to practice from Jan month till now. Now, 4 of them, if they suffer from even fever, cough, diabetes, hypertension, anything, they will come to us. This is a speciality of our Ayurveda practice. Once their fever or any diabetes, it comes to control, whatever the medications we give, they will come to us. And every month they keeps coming us. That's why we got to know that our treatment worked. This is the way how we have to practice. And one more thing I want to tell you is, any patients has any type of problem, they will approach Ayurveda doctor. The public doesn't know the specialities in Ayurveda. If you are a physician, even for piles they will come, even for fissure in it, no, they will come, and rectal ulcer I have seen. No, if you just designated as BM as MD, okay, if you just designated as BM as MD physician, people with all the diseases they will come to us. Okay, that is a specialty in our practice. But in modern science, it's not like that. If they have high problem, they will go to ophthalmologist. If they have any pain abdomen, they'll go to surgeon. If they have fever, they'll go to physician. If they have diabetes and hypertension, for these three things only, they will go to physician. Or any asthma comes, again, they'll go to pulmonologist. So that is the difference between modern medicine practice and Ayurveda practice. Only thing is, our medicine should work. So patient will come back and they will have a trust on us. This is a case, second case. Then third case is a female patient of 75 years diagnosed case of bullous pemphigoid with fever from past 5 days. See, fever occurs due to two reasons. One is the inflammation, second is the inflammation. There is a very lengthiest difference between inflammation and infection. See, the first two cases, what I told, no, patient has just fever with slight cough and rhinitis. It is an infection. It it is indicative of infection. And second patient, you that's what patient, that male patient of 35 years who came with continuous fever, body ache, generalized weakness. That patient has infection. He had infection. He didn't have any inflammation. But here, case 3 is, it is the diagnosed case of bullous pemphigoid. It is an autoimmune disease. Okay. And patient has fever in this case from past 5 days. Okay. So no other comorbidities are present, but bullous pemphigoid is an autoimmune disease. Now I want to treat a patient of autoimmune disease who has fever from past 5 days. Okay. So I checked BP, it was 90, 70, pulse rate was 96. Of course, she is dehydrated, but then when I examined skin, active blisters were there with flutes. Flute filled blisters are there over arms, legs, upper back, neck, and stomach. Almost all the body parts. Okay, treatment was given for 15 days just to cure her fever, not bullous pemphigoid. See, this bullous pemphigoid, it's just like some other grave disease. If you have blisters all over your body, just think how you may be suffering. You just imagine that. Many patients are suffering from this disease. This bullous pemphigoid patient has fever and she came to me and how to treat her. See, I have not completely cured bullous pemphigoid. Here, what I'm telling you is how I treated fever patient associated with bullous pemphigoid. So hydration is mandatory. Why? Because her pulse rate is little high. See, pulse rate may go up to 120. Her BP may go to 80, 60 like that. If they are severe dehydration, in dehydration also three types are there. Mild dehydration, moderate dehydration, severe dehydration. If it is severe, pulse rate will be 120. In vitals, it may go to 60, 50, it may go to 80, 60, like that BP also. Then patient is in hypovolemic shock. We need to gradually give them flutes. That time I can't treat that patient in my clinic. So these are all the limitations of how to treat a patient that we should know. Any patient comes to you, first you need to check patient is, you need to observe the patients how they enter our OPD. One thing. Second thing is, once the patient comes to us, if they are restless, first you need to check pulse rate, because you don't need any instruments to check pulse. You see how much is the pulse rate per minute. Take a watch and you see, then you'll get to know. Then how is the rhythm? Is it regular or irregular? These two are very, very important. Why there is too much significance to Nati Pariksha in Ayurveda is, pulse rate is the one which tells us everything, that too in case of fever. Pulse rate is such an indication of any type of disease. See, how I tell you is, when I was treating dengue patient, I will tell you a history. That patient came with a report of thrombocytopenia, which is of 19,000. He came with a report of 19,000 of platelets count. Then I checked his first. I saw pulse of the patient. His pulse is wonderful. It is normal, and his rhythm was also normal. But in case of patient who have thrombocytopenia, you will not see such type of pulse. Then I found out that patient didn't have this much less platelet count. Then I checked this platelet count again, and it was 91,000. See, it came back to normal. You know how dengue works and how thrombocytopenia return backs within 24 hours if we give enough medication or if they take orally. Dengue fever is like instant fever, because once, if platelet count is 28, from evening it may show 50, and morning it may show 90. And one more thing is, if it is 28, if you don't treat a patient, if he's not taking orally, he may go to 9. Then we need to transfer the platelets, single donor platelets, STP, like that they'll come. We need to transfuse, so we can't predict anything on one disease. Once you come to practice, you will definitely get to know about dengue fever. And many patient goes to dengue short syndrome. Now patient is okay. Now patient is very stable, like 28,000 with all our whole is stable. But after that, within 5 minutes, within 4 to 5 hours, they may go to dengue short syndrome with bleeding. So we can't predict anything. So in case 3, Brahmi Vati, Mrutyunjaya Rasa, Arogya Vardhini Vati, and Lepa of Yashtimadu and Triphala is given. Here in case 4, a female patient of 64 years diagnosed case of Amavata. She complains of fever since 15 days on and off, decreased intake of food. Her vitals were stable. See, she is a female patient of 64 years diagnosed with Hamavata. Again, it is an inflammation. How I treated it is Kshirapaka once in a day in empty stomach it is given. You know the Kshirapaka. Lashuna Kshirapaka is specifically indicated for Amavata with Jwara. And Tribhuvana Kirtirasa, Simhanada Kukulu, Chitrakadivati, Makaratvaja. These 5 are given to a patient. Within 5 days, her fever came down. But I have not completely treated Amavata. How I treated fever with Amavata, I'm giving you. And case 5, a female patient of 42 years came with history of fever since 2 days, and it is associated with loose stools. Again, it is a case of infection. Fever caused due to infection. In such case, Guduchi Sattva I gave Kutaja Ganavati. So we need to treat the cause. It is not only the fever. Why the fever they have, that we need to treat Kutaja Ganavati to stop loose stools, and she was not having more loose stools. And Dadi Mastaka Chuna is given 1 teaspoon with warm water. Then Guduchi Sattva. Guduchi Sattva works wonders. Why? Because you know the heat of Guduchi Sattva if you have prepared. Even from 100 kg of this one, you may get even 100 gram of this Guduchi Sattva. So the heat is very less. So why? Because it's very, very potent medication. Then Amaja Jwara. See, when patient has all these symptoms like Tandra, Lalasrava, Arochaka, Alasya, Vibanda, Bahumutrata, Guru Udara, Guru Gatra, Ashuddhi Mukha and Glani. So in such conditions, Amapachaka plus Jwaragna you need to try. How to give Amapachaka is Chitrakadivati. It is Amapachaka as well as Agni Deepaka. But Shankavati works more on Agni Deepaka. And Agni Kumara Rasa, Agni Tundivati. These works both Ama Vachaka as well as Deepaka. Along with that, some Jwaragna drug you need to give when patient has all the symptoms with Amaja Jwara. Some patients will comes to you with history of fever, and this fever is not due to infection or inflammation. It is due to Shraman Kshayajanya, debility. They might have more works, or due to Kshaya, they have a fever. So in such conditions, how you have to treat a patient is Krutayukta Mamsarasa. Only in such case, Krutayukta Mamsarasa you can advise and Odana. Many patients comes to you just by telling a history of frequent attack of fever. If you check their CBC, it may be more, less than 10. So in such conditions, that then it is the debility you need to consider. It may be Pandu, and why she is anemic or why he anemic, that we need to know. Many causes are there. But here, if they have fever and kshaya and shramajanya, in such conditions, you have to give one loha. Which type of loha is this one? Tapyadi loha or Navayasa loha? Than Saptamrita loha. Why Navayasa loha is Trifala, Trikatu, Trimada, three are there. It will ignite the Agni, it will do Amapachaka, and it will help to get rid of fever. It works in three ways. And Deepana Pachana with antipyretics and some strength promoting drugs you need to give. Talisadi Chuna, Sitaupaladi Chuna, they all work wonders in such conditions. So, which type of water you need to give? Warm water, Deepana, Kafachedana, Pitta, Vata, Lomana. See, in fever case, you need to give only warm or lukewarm water. If it is Pittaja, Madhyaja, Vishaja, lukewarm water. In warm water, it is only in case of Kapha, Vata, Janya. Cold water is totally contraindicated. When you have to give milk to a patient, it is Vata, Pitta, Jwara, Krusha, Alpadosha, Ikta, Jeena, Jwara, and Pipasarthas. See, some vegetables are described in Ayurveda, Bala Mulaka Gudichi Patra, but I don't advise my patients to take vegetables when they have fever. Definitely. And Yusha is Chanaka, Kulatta, Mudga, Masura. These four types of Yusha are advised, but in my clinical practice, I give only Mudga and Masura. It is not the Chanaka or Kulatta. Because Mudda and Masura, they are Lagu in nature as well as they are Tipaka Pachaka. Yeah, in case of Vataja fever, what you need to advise is it is the Anna and Mamsarasa. In case of Pittaja is Anna and sugar. In case of Kafaja is Anna and Mudga Yusha. See, any Vataja patient, that's why I advised Anna Mudga Yusha. Why? Because in Vata Kafaja fever, this is the. In Baishaja Ratnavali, here you see the reference. If patient has kafaja jwara, heaviness, lalasrava, guru gatrata, all such symptoms are seen, you advise just mudga yusha to take or else khichdi. So khichdi is prepared by combining this rice and mudga, no? Then in case of pitta jwara, more of Daha, then Trushna. In all such conditions, Ganji is called in our Ayurveda. Okay. Anna with sugars, which is boiled, or Anna with jaggery, which is boiled and given to patients. So that works only in case of Pitta Jwara, in not Kafaja or Vataja. In case of Vataja Jwara, Anna and Mamsarasa is given. Many people have a habit of taking Mamsarasa, meat soup, whenever they have fever. It is not advisable in all types of fever. It is advised only when patient has Vataja Jwara. Okay, this is the diet you need to know and you should advise to a patient. There are many classical formulations which is advised for Jwara. Samshamanivati, Guruchi Sattva, Sudarshana Ganavati. These are all the rasas as being a rasa vaidya, how I treated patient is. Ananda Bhairava rasa is given, Tribhuna Kirti rasa, Kasturi Bhairava, Sutta Shekhara rasa, Mrutyunjaya rasa, Sanjeevini Vati, Amrutarishta. All these are the classical formulations we do give. Of course, if they have some underlying disease, it will all the choice of any drug will be different according to the yukti of a patient. Many patent formulations are available. Tapfifitrol, Ayur Defense, Pranadhara is for steam inhalation only. Flu mixture, tablet Chiromol will come, that is for fever. P plus tablet is for thrombocytopenia, and Dizomap will come, Livomap will come. All these are Amapachaka and Agni Deepaka, Tulsi Kalpa. These are some of the patent formulations what we practice in our. So now I hope all of you have understood the concept of Jwara. How can we treat Jwara using Shaman Aushadhi? See, patent formulations are over. Classical formulations you can choose according to the yukti of patient and how you have to advise a diet to a patient. Many patients will come to us. Which type of food should I take? Can I take milk or not? Can I take paneer? All these are the questions which are asked by patients. So we need to be ready to answer. Vegetables, can I take vegetables? They may ask. And milk, which condition? See, only in case of Vata Pittaja. Then water, of course, cold water is contraindicated. Debility, it's discussed how much Jwara. All see, Jwara is a big topic. I can't share all my experience of Jwara, But we will get Jwara only when our body has infection or inflammation, either infection or inflammation. And patients get fever in almost all the conditions, in almost all stage of fever, because either little infection may be there. Once patient is diagnosed with Amavata, you may get frequent attack. Day by day it becomes worsened. Even at the end of the day, they may have Jwara. See, once you start to practice, you will get to know where and all patient may get fever. If fever is there in a patient, of course, it is an indicator of to either infection or inflammation. In modern, they will treat with antibiotics and antipyretics with fluids. In our Ayurveda, we will treat with many rasaushadis. Pathya is very, very important. Hydration is very, very important in Ayurveda. Then after that, then the medications according to the condition of the patient and according to the dosha involvement in a particular disease. I hope all of you have understood the topic. Next week we will come up with one more topic to discuss with disease, and some other Rashastra classes are also going on. You may watch Rashastra classes, and otherwise you may share it to the known people. And one more thing is, whatever the classes we do take, even if you can't attend, no need to worry. We will upload in our YouTube channel. You can watch it. And if you have any doubt, you people may ask. We are here to. We will try to solve your problem. If you have any doubt, you may ask.